I'd like to talk about donor hair preservation. What does that mean is that you have a finite amount of hair from the donor area that we can take to harvest and to transplant. In the past several days, I've seen several patients who've had transplants performed at other clinics by other providers, and they're coming to me because they want a second or a third procedure. And the question is are they a candidate? Are they not a candidate? Do they have donor hair? And if they do, what's a safe amount of donor hair that we can take for the next procedure? And if we are going to do the procedure, where can we place that hair? So if someone's had a previous FUE procedure, I do a full exam of their donor area. I want to evaluate the density that's remaining, the level of miniaturization that they may have in the donor area, and what would be a safe amount of donor follicular unit grafts that we could take to transplant. And once I discuss that with the patient, where would that best be served? So in general, if they have a lot of thinning in the front and we're not sure about how much more donor hair or how many more procedures they can have, you want to make sure the front is filled in well, the front and the top. The crown should generally be last, especially in someone that has diffuse hair loss on the entire front, top, and crown of their scalp, because it's more natural to have hair in the front and the top and then thinning in the crown. So we want to preserve it and transplant the hair in a natural, age-appropriate way, but while preserving the donor region. So that's really important, especially if you've had a previous procedure, to make sure that your physician evaluates, examines, and takes a full assessment of the donor region and discusses that with you, because it's really important to know what you have available now and potentially down the road as well for further procedures.